PhD. I'm the Director, Narcotics and Controlled Substances Directorate of NAFDAC. And in my presentation, I added a slide just to let us know what that directorate does in fulfilling the mandate of NAFDAC. So I need to step down because I'm using my phone. I'm not seeing all the slides. Is that okay, please? Is that okay? Can you help us with the first slide? I don't understand that sign language. He's making some signs. Maybe he has mental health issues. So we're in the right place. I absolutely loved the presentation from the keynote speaker. And I think that's the presentation everybody should take a copy home and read it and absorb it and talk about it. Because in talking about it, we are going to be able to help the people around us. He gave us the key drivers of the problems in mental health. And I really like the statistics that he gave us. Because these are statistics, and I mean, he said he did this work himself. And these are statistics that speak to some of the things that we already know. And it's interesting that the Gen Z generation are the ones who are mostly affected by suicide. I don't think he mentioned Gen Z, but he gave the age range. It's very important. And I'm sure if you're a parent or if you're into nurturing the young ones here, you've probably heard the term, which wasn't very popular before, oh, it's affecting my mental health. True? Everything, oh, it's affecting my mental health. Today my driver said that, I fired him. Okay, so unit trust, how strong regulation improves access to mental health treatment. This is a presentation by the DG of NAFDAC, Professor Mojisola Christiana Adeyeye. Next slide, please. Our introductory slide, what mental health is, and thank you, the keynote speaker. You did an excellent job on all the definitions, and I like the way you made it practical, so everybody knows that they're on the spectrum. So you decide per time where you are on the spectrum. So mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn and work well, and contribute to their community. Next slide, please. We might need to go a bit, so media, please stay with me. Remember, they changed my time from 20 minutes to 10 minutes. That's already giving me mental stress. So please stay with me. The absence of sound mental health leads to mental health conditions. Mental health condition is a great global concern, and Nigeria is not exempt. These conditions include anxiety disorders, depression, PTSD, OCD. So PTSD is post-traumatic stress disorder, OCD is obsessive compulsive disorder, suicidal addiction, which the keynote speaker focused on. WHO estimates that 1 in 4 people will experience a mental health condition in their lifetime. Rising suicide rates among youths aged 15 to 29 is a call for urgent action. NAFDAC's mission goes beyond regulation. It is about protecting lives and building public trust. Next slide, please. The suicide situation. I think we already know this, so I can skip it because I think the keynote speaker did an excellent job. So let's skip this slide and go to the next one. The role of trust in mental health access. Trust determines whether people seek help or suffer in silence. If they don't trust the medication or the counsel that they are going to get, they will not seek help. And we know that in this situation, that will not be good. Patients trust the medications if they have good clinical outcomes. If you take a drug and you feel better, the chances are the next time the doctor says, take this drug for this particular ailment, you will take it. But if you take it and it does not work, you're not likely to either go back to him or to take that particular medicine again. Distrustful self-medication, stigma, and avoidance of care. Building trust equals building access and reducing preventable deaths. Next slide, please. NAFDAC's regulatory role. We ensure the quality, safety, and efficacy of psychotropic and antidepressant medicines. A few times I stepped out doing this presentation, so I'm not really sure. But we know, I think, yeah, but I was it when he said that 90% of these cases is due to mental illness. And some of the highlights of those mental illness will be anxiety, it will be paranoia, it will be depression. And there are medications for this. There are people who take them and they take them for life. And they live normal life and contribute to society. So there's nothing wrong with that. Where the problem is people do not talk about it. People do not want to go for treatment. They don't want to take the medications because of the stigma that is attached. But there are drugs for anxiety. They are called anti-anxiolytics. There are drugs for depression, antidepressants, and many others in that class. We prevent falsified or substandard medicines that worsen illness. We monitor and control the importation, manufacture, and distribution of medicines, including the ones that I have just mentioned. And we support the implementation of the National Drug Control Master Plan and Nigeria's Mental Health Plan. When the staff from NDLA was speaking, he talked about this National Drug Control Master Plan. We had that meeting 2 weeks ago, yes, in Suleja, where we all contributed to preparing the plan for 2026 to 2030. Next slide, please. The regulation of narcotics and psychotropic substances through the NCS directorate, our responsibility is regulation, monitoring, control of narcotic drugs, psychotropic substances, and other precursor chemicals, because you know that there are some chemicals that can be easily converted into hard drugs. We know that's right. So NAFDAC also controls that. Our focus is availability of controlled substances for legitimate medical and scientific use. Yes, some of these drugs have a high addiction ability, but they are used as treatment. So the role of NAFDAC is to ensure that there's access and that it is available and that it is used properly. Where it is not used properly, they will have a visit from NDLA and NDLA will carry them away. Okay. So we collaborate with NDLA, the Federal Ministry of Health, the UNODC, and the INCB for transparency, accountability, and effective implementation of Nigeria's obligation under the Global Drug Control Conventions. There are 3 conventions. Nigeria is a signatory, and NAFDAC is responsible to ensure that we carry out the necessary controls so that it is not diverted for illicit or illegal purposes. Next slide, please. Next slide. Regulation is a tool for public confidence. Strong regulation builds confidence in the healthcare system. Transparent drug approval and market surveillance ensures that only safe medicines are available to the public. Collaboration with INCB, WHO, and partners strengthens our oversight functions. Example, streamlining registration and strict regulation of essential narcotics and psychotropic medicines to ensure accessibility and prevention of abuse. So the way we do this is, so for example, there are different schedules of psychotropic substances, Schedule 1 to Schedule 4, and for Schedule 1, it's only the Federal Ministry of Health that can bring it into the country. That's why we have morphine, there's petidine, there's cocaine, but typically it's morphine that they want to bring in. So it's only the Federal Ministry of Health. But if they are not able to, so what they will do is get an accredited vendor who can bring it in. And this is stored in their warehouse, so they write to us, tell us the quantity. We give a license, we give the approval, the vendor brings it in, and then all the different hospitals that need it go to the Federal Medical Store in their zone. So now there are 6 zonal centers all over the country. So they write, based on the prescriptions that they're getting, they go to the Federal Medical Center to get what they need. And usually these are small quantities. So what NAFDAC has done now to ensure that there's traceability, that we can track and trace every vial of medicine that comes, narcotic products that comes. We have there's a vendor that we have, that we're collaborating with, where each of those products will have a 2D barcode. And with that, we can trace it from when it gets into the country to when it gets into the end user. So if there's a product like that, I have the scanner on my phone and everybody can download it from the Play Store. You can scan and it will give you all the products, all the characteristics of the products. During COVID, we also use this track and trace system. So for every vial of vaccine that came into this country, so not only are you looking at the carton, you're looking at the individual pieces, because that's what the problem is really. You don't want to lose even one vial or one tablet or one pack. So there's a serialization beyond even just the secondary packaging. The inner one, there's a barcode on it, and we can trace where those things are. So for those that we give licenses to, we're able to trace them. We're able to trace them to the end user. Next slide, please. Poor regulation can lead to unsafe drug abuse. So can lead to